Well, hello everyone, and thank you so much for joining this webinar organized by the American Academy of Anti-Aging Medicine here in Dubai, United Arab Emirates. The objective of today's webinar is to discuss how, as a physician, you can revamp your career with our organization, and more specifically, how can you revamp your career from your current specialty to becoming part of the aesthetic medicine subspecialty. So today's agenda is to discuss how we can help you in your new career journey, how we can advise you on the opportunities and the regulations surrounding this market, more specifically in the UAE, how we can guide you in your choices. So the first part of this webinar will be presented by myself. It will last a maximum of 30 minutes, and then by my colleague, Mr. Milton de Souza, for a maximum of 15 minutes. The objectives of this webinar is to review first the aesthetic medicine market today. So we will assume that you are quite new to this subspecialty, and we will give you an overview of the trends and opportunities and the general regulations surrounding aesthetic medicine. How to get started, how to set your goals, how to make a budget, how to plan the costs, and what are your earning potentials salary-wise. How you need to revamp your profile in order to be successful in this industry. And finally, how and where can you get started to start training. So about us, if you don't know the American Academy of Anti-Aging Medicine, Dubai, we are an affiliate of A4M, which was established in the USA in 1992. So this gives us 28 years experience in educating physicians about the latest anti-aging and aesthetic medicine research. We have been on the market for a very long time, and we have therefore gained the credibility not only in the US, but also UAE, Middle East, Europe, and Asia. 7 years, and we've been working very closely with the authorities since then to make aesthetic medicine a specialty that can be practiced not only by dermatologists and plastic surgeons, but also by GPs. Myself, I have 10-year experience with A4M worldwide, and I'm a specialist of medical education. My colleague, he's been advising more than 500 aesthetic specialists throughout his career at A4M Dubai. So how can we help you? First of all, we're very active in research. So our faculty, who you will meet during the courses, are active clinicians. They themselves use and combine different protocols that they always test and research. They then present all the data in the courses. This is very important because your trainers will not be simple clinicians. They are trainers who have written and published papers in their respective fields as well. We advise you, so on average, we will speak to 50 to 100 physicians like you per week. That's a lot of them. We speak to physicians from UAE, from Kuwait, from Saudi Arabia, from Europe, from Australia. So we play a big part in advising you what are the ABCs that you need to take in order to become part of this subspecialty. We teach you, so we teach an average of 3 to 5 courses per month. Each course is usually 2 days, and we have been teaching those courses now for over 10 years and for 7 years in Dubai. And finally, we support you. This is a very important aspect of our training and our organization. Once the course is over, we remain here by your side. We have built a community of physicians like you who've gone through the trainings and are now in their respective practices and facing day-to-day cases, sometimes complications or challenges. So you'll always have access to that support group at any time. You can post a message and get answers from your colleagues locally or around the world, or even from the faculty. So let us look at the aesthetic medicine market today. So there are mainly 4 indications in aesthetic medicine. The first one is surgery, which actually falls under the category as well of aesthetic or cosmetic surgery and is usually carried out, of course, by the plastic surgeons. But there are minimal invasive surgeries such as fat grafting, which in some countries may be performed by physicians who are not plastic surgeons, but you do need to verify the regulations in your given country for that. So surgery does tend to remain, of course, apart, aside from the other three main categories of aesthetic medicine, which is injectables, lasers, and cosmeceuticals. What we mean by injectables usually is mainly soft tissue fillers and neuromodulators. So soft tissue fillers such as HA products, hyaluronic acid, which are used for filling and contouring the face, but also the body. And then we have neuromodulators, also known under the commercial name of Botox. And we use this for upper face, for lower face as well. Then we have the lasers, which also encompasses energy-based devices. So lasers and energy-based devices are a very important part of an aesthetic practice for skin refining, which usually we recommend to work with the skin texture before you can start working with the filling or with the toxins. So lasers usually laser hair removal is usually performed by laser technicians, which usually would be a nurse or a beauty therapist. But laser skin resurfacing or laser skin rejuvenation or skin tightening with energy-based devices like ultrasound, radio frequency, this is performed by the physician like you. If you do wish to delegate this, you have to check the regulations. Some procedures might be allowed to be performed by your laser therapist, but usually it always has to be supervised by a physician. That's why it's very important for you to get trained in the field of lasers as well. This is under your clinical responsibility. And making a choice when it comes to purchasing a laser for your clinic is also a very big decision and investment. Hence the need to really be familiar with which technologies work best for the indications that you will be seeing in your own practice, depending also on your geographical region, because you will be facing different skin types and different skin conditions. Cosmeceuticals, last but not least, such as mesotherapy, chemical peels, microdermabrasions, hydrofacials, which are very popular these days. All of these are also an integral part of your practice in order to maintain the skin of your patients. And this can be with home care products, but also what is being done in the practice. So this can be carried out, of course, by your beautician or by your aesthetic practitioner, but you as a physician will need to be very familiar with the different chemical peeling agents, with the mesotherapy cocktail and ingredients that can be used. And they're very good in combination as well to the other protocols that we've just discussed. So let's look at aesthetic medicine and its status as a recognized medical specialty. We get this question a lot. Can I practice aesthetic medicine? Do I need to change my license? Aesthetic medicine is not a recognized medical specialty. It is not like dermatology or plastic surgery or family medicine, for example. It comes as a subspecialty, usually under dermatology, plastic surgery, general practice, ENT, maxillofacial surgery, family medicine as well. Even gynecologists now start to practice aesthetic medicine. So it's important for you to understand that it is not a separate medical specialty. So you still need to go ahead, usually in most countries, and get your license or get registered with your council under your current specialty. Let us look at the procedures which are the most popular these days in aesthetic medicine. What the most important trend that we can see at the moment is that surgical procedures are decreasing. So there's definitely a demand from patients to have more and more less invasive procedures with less downtime. And the demand for this is also, of course, led by the innovations and the results that we are seeing constantly improving with non-surgical procedures like injectables and peels, mesotherapy, lasers, for example. So surgical procedures are down by 0.6% and non-surgical procedures are up by 10.4%. So all in all, this represents an increase of 5.4% for aesthetic procedures in general from 2017 to 2018. And this trend, the 2019 data is not released yet, but undoubtedly the figures will keep confirming this. What are within non-surgical procedures? The top 5 procedures. Toxins with especially upper face neuromodulator treatments for the glabella, the forehead, and the crow's feet amongst men and women, by women and men especially as well. Hyaluronic acid soft tissue filler procedures are the second most popular, and they've been up by 11% from 2017 to 2018, whereas Botox was up by 17%. Laser hair removal is still as popular as ever and remains amongst the top 5, although it's been decreasing a little bit overall from one year to the next. Non-surgical fat reduction, so it can be with technologies like ultrasound, radiofrequency, and then photorejuvenation. So what is the patient profile? So if you try and project what type of patients you're likely to see in your practice by age, first of all, the most active age group in aesthetic medicine currently is the 35 to 50-year-old age bracket. And this is followed by the 51 to 64-year-old age bracket, and then 19 to 34. So the younger group is still an important part proportionally of your target customer. You have to know, of course, that with younger patients up to 34 years old, their objective mainly is beautification or enhancing their facial features, whereas with the older age groups, you're looking at more procedures more orientated towards overall rejuvenation and wrinkles and contouring with filling. And by sex, you will see that currently men are representing approximately 12% of the current market. So it is not a negligible number. If you think that in a day you might have 10 patients, 1 out of those 10 will be a man. If you have 20 patients, 2 to 3 out of those will be men. So what treatments do men tend to request? They are usually very interested in toxin procedures, but also laser hair removal, especially in our part of the world. Some of them might even ask for fillers. So you really have to understand what each age group or sex might be requiring so that you can also optimize your marketing and your offerings in the clinic. So let's look at the aesthetic medicine market. The value of it is currently $52.5 billion US, and this is forecasted to grow for another 8.9% over the next 5 years. So if you're concerned about the stability of the aesthetic medicine market, perhaps especially in 2020 with the COVID pandemic, we can tell you that aesthetic medicine market currently has not seen a drop in its demand and in its growth, even after the pandemic. So cosmetic clinics are still very busy. Patients are continuing to invest in their looks, and patients who were active consumers in this market still seem to have that disposable income overall. So what is leading the growth of this market? Well, mainly product innovations. So there are more and more technologies coming on the market, more and more new technologies and new devices, new innovations, new types of products, more and less invasive products, which are more and more attractive to consumers. This is the availability of these products in the market is pushing the awareness of consumers for the availability of procedures, and is therefore leading to also more competition and therefore more affordable prices at the end for the doctor to purchase these from the manufacturers, but also for the patient once they're purchasing this from the clinic. Disposable income, well, more and more aesthetic procedures are becoming affordable as part of the disposable income of the society, and also the ever increasingly awareness for physical appearance with the social media rise. So more and more Instagram or Snapchat are playing a very important role in consumers being aware of their looks or comparing themselves to other influencers out there on social media, and therefore they are being led to consume themselves more aesthetic medicine procedures. So with the years and throughout the 21st century, we have really seen population generally paying more attention to their looks and being more aware of that. So how can you enter the aesthetic medicine market now that you know that this market is viable and you understand what are the main components of it? First of all, you need to be aware of the regulations and the licensing aspect of things. The salary, of course, is always an important question that we get, and then how to get trained. So let us look at the first part, the regulations and the licensing. So what do you need in order to be licensed and allowed to perform aesthetic procedures, and who can do what? So this would depend on where you are currently in the world. So I have this world map, which is showing you different countries and different regulations. If you look at the ones where there is the green text, Canada, USA, UK, Australia, New Zealand, for example, you will see that even registered nurses are allowed to inject. So this is not a specialty, subspecialty exclusive to physicians. However, if you look at countries like the UAE, it will be all physicians except dentists. We will go into this in further details later on. And then you have countries such as Bahrain, where only the dermatologists and only the plastic surgeons are currently allowed to inject. So regulations do vary hugely from one country to another, but what we can say is that they are very fast evolving. So what might be true as of today may not be true as of tomorrow. But generally, we are going towards an opening and more flexibility of the procedures. As long as the physician is trained, authorities tend to authorize more and more specialists to join this field. I have put an exclamation mark next to the USA because in the US, you need, if you're a physician, you need to go through the USLME exams. If you don't know what they are, we're not going to go in details about this tonight, but the USLME exams means that whatever degree, medical degree you might have had in any country outside the US needs to be revalidated before you can practice and be registered in the USA. And this is a very lengthy process that a lot of physicians do not wish to go through. So you have to bear that in mind. And even if you take our courses, which are US affiliated, this will not bypass this requirement. So let us look at the UAE. We know that a lot of you listening to this webinar will be based in the UAE, and we are ourselves based here in Dubai, so we would like to spend more time on this. In the UAE, United Arab Emirates, we have four governing authorities. One of them is Dubai Healthcare City, which is an area located within Dubai, but it's not all of Dubai, which falls under Dubai Healthcare City. It's only a specific area. That's where our training center is located. We then have the Dubai Health Authority. We then have the DOH, and then we have the MOH, the Ministry of Health. And these basically are authorities for different emirates. So in Dubai, everywhere except in Dubai Healthcare City, you will be governed by Dubai Health Authority. If you are located in Abu Dhabi or Al Ain, you will be governed by the DOH, the Department of Health. And if you are located in any of the other emirates, such as Sharjah, you will be governed by the Ministry of Health. So all of these four authorities tend to move towards a unification of their policies. So now we have reached a stage where the regulations tend to be very similar across the board if you want to practice aesthetic medicine, but there are slight differences and slight exceptions from one authority to the other. So we don't have time in this webinar to go through each and every single one of them. We will go through now the DHA, Dubai Health Authority, which is actually, let's say, the main one where there are the most physicians practicing. But if you want to double check for Abu Dhabi or DHCC, we also have guidelines for those. So we want to show you now how to access the Dubai Health Authority guidelines through the web. We get this question a lot, so we have this screenshot here. So if you go on Google and you type DHA, Dubai Health Authority, non-surgical cosmetic guidelines. This will return a link which is on the DHA website, the first one, dha.gov.ae. You click on this link and this is downloading a PDF document. You can see in the bottom left of our window here that you will then be able to open. It's a 28 pages document accessible for you over the web. It was last updated in 2018. So you can spend some time to go through all of those. Each of you who are practicing in Dubai should be familiar with this. So we want tonight just to focus more specifically on the guidelines with regards to each procedure and which physician can or cannot do them. So you can see here on this table, the last row, number 8, fillers and botulinum toxin injections. This can be performed by consultant physician or other physicians. And then you can see for the other procedures such as mesotherapy, laser hair removal, you will be able to spend more time to see what type of physicians or healthcare professionals can or cannot do them. So let us go again over fillers and botulinum toxin injections. I know we would get a lot of questions if we don't spend more time on this. So consultant specialist physicians are allowed. As you can see, there is a tick box, and this means dermatologists or plastic surgeons, and they do not require training. You can see the notes here, section 2. So strictly speaking, by the DHA, they do not need training. However, if you're a dermatologist and you're listening to this webinar, you will be a clinical dermatologist and you may have never been exposed to injecting soft tissue fillers or neuromodulators. You will for sure require a training, of course, before you go ahead and do it. So that evidence of training is not compulsory and you do not need to submit it anywhere. But of course, in order to be safe and to be confident, it's very important that you consider taking a very intensive and detailed course as well. And then all the other physicians here, number 3, are also allowed. And this means all of them except consultant derma and plastic surgeon require training. So this would be family medicine doctors, GPs, gynecologists, any other physicians can do it, but they do require training. So here is a confirmation of what I've just mentioned, but the dentists are excluded. So let us look at the standards. This is just an extract from the document that we have just showed you, which is over the web, showing that you will need appropriate certification and training, and you will need supervision by a consultant, a dermatologist, or plastic surgeon if you are a GP. This is important. So you do need to have a derma or a plastic surgeon in your clinic supervising you. Course requirements set by the Dubai Health Authority in that document are that, again, you must undergo training prior to practice, and this training must have a theoretical component. You have a detailed listing here. All our courses are covering those, of course, and a practical component. As per the DHA, this has to be at least 50% of your training. In our courses, the practical component is 70 to 80%. We put a very strong focus on the hands-on training, and we always ensure that you walk away having injected several patients. And there needs to be an exam, which can be oral or written. We do have an assessment, which is in written form and is for 60 minutes with multiple choice questions and with also patient photos, and you have to give a recommended treatment plan. So how does licensing work in the UAE? There is no separate license in the UAE for you to practice, again, Botox or fillers. However, if you're already licensed in Dubai, you will know that you will have an online account through the DHA website. There is a screenshot here. You can simply log in and you will be able to update your records and state that you are performing Botox and fillers as well. So the specialists that we trained at FOM Dubai, if you want to have an idea, there is here a 3-year analysis. So you can see that 3 years ago, in 2017, we used to train as many GPs as dermatologists as other specialists. It was very even. In 2018, we started seeing a huge increase of the number of GPs who wanted to join this specialty. It doubled. And this is also coinciding with the regulations of the Dubai Health Authority, which became more open and allowed the GPs to practice with training. And then in 2019, that trend continued to increase with even 70% of GPs. Still, we do train about 25% of dermatologists on average. So let us look at the salary and budget considerations. The salary prospects. So we don't always get this question because not all of our physicians want to ask us directly, but we thought it would be good to discuss it in this webinar. So we can show you the expected earnings on average, of course, in the UAE for a GP or for a dermatologist. GPs usually without experience will start just above $6,000 as a fixed salary, and this will go up steadily over the years when you're building the experience all the way up to 13, 14, and maybe more, of course, depending on your clinic. For dermatologists, the starting salary usually with no experience in aesthetics would be more around $11,000 and can go all the way up to $16,000. This is for the fixed salary. But we can see that usually, according to these two models here, the fixed salaries are supplemented by commissions. Commissions for the number of procedures that you perform in a given week or month. So for every procedure that you will do, you will take a percentage, which will be based on the value of the treatment that is retailed to the consumer, or sometimes it's simply based on the revenue, the turnover that you are making for the clinic. So they might say, if you are making twice or 3 times your salary, you will get X amount of commissions. There is another model, which is the revenue share only, whereby you do not take any fixed salaries. And for every procedure that you do, the clinic will deduct the cost of the products and the consumables, and the profit that remains will be divided. It could be divided on a 50-50 basis, 60-40, 70-30. It's up for negotiations. So what is the investment that is required from your side before you can get onto the aesthetic medicine ladder? For training, well, here is an average investment for the courses. Our most popular and most prestigious course is the fellowship, which is the most intensive one. You will have 6 full days of training with us. You will have 72 hours online, and you will have an exam. You're looking at an investment of about $14,000. It is an investment. We do offer payment plans for this, but this is something that will set you on the path of the aesthetic medicine career. You will be able to not only do fillers and Botox, you will be able to do any body contouring procedures, lasers as well. It's an A to Z training and is the highest level training that is currently available in the market. We then have the A4M certification, which is more specific for injectables, and you will have 4 full days of injectable training, and you will become certified in advanced injectables, and that will cost you around $8,500 to $9,000. You can then decide to not go for these fully pledged courses, but maybe you want to do just a single course, which is usually 2 days. And this will cost you around $2,500 to $3,000. You can go to conferences, of course, and this is usually about $1,000, but you will not get the hands-on experience in conferences usually. And of course, we should not ignore the availability of online resources. You have a lot of webinars now that are being offered by the companies themselves who are manufacturing the products, and they're very informative. You also have access to YouTube, for example. You have access to Medscape to read papers. So all of these are free of cost as well, and they're very good to use in combination with the formal training. In terms of equipment and marketing, this is very basic, but just for you to think about it, with lasers, your investment is very high. You're looking at from 80,000 US dollars for a laser device on average. Of course, the prices vary hugely, whether you're buying a market-leading device, manufactured in the US or manufactured elsewhere, versus a device manufactured in China or Korea, for example. So you need to do your own research for that. Of course, if you attend the courses, we will discuss it and we will show you a lot of different devices as well, and you can judge for yourself which ones you think, which technologies are more important for you to have in your practice. You will not be able to have all of them, of course. With fillers, you can see that the investment is very minimal. We can barely see the investment, but we're looking at around $100 to $150 per syringe. So the attractive aspect of starting with fillers or toxins is that you can just buy as you go. Let's say you can buy 10 syringes of fillers, 20 syringes of fillers, and you can use those. And when you run out, you just purchase them again from the distributor. Marketing, you do need to allow a marketing budget. You will not be able to be an aesthetic physician without marketing yourself. So do allow maybe $500 to $1,000 monthly that will be invested towards your website and your social media profile at least. And then you need to set goals. So this is more generic, but we really want to advise you very strongly to set your goals from the outset. Where do you see yourself in 3 years from now within the aesthetic medicine market, or in 5 years from now? Because if you fail to plan, you really plan to fail. So we are here to support you and guide you through the planning, whether you just want to start with a single course, only with fillers, or if you want to have a whole spectrum of aesthetic medicine procedures that you can do, we can work a plan with you. And then you need to ask yourself, why are you doing it? So are you doing this for the money? Are you doing this for the happiness? Or are you doing it for both? Are you doing it for any other reason? It's a very personal decision. But what we notice is that, of course, the aesthetic medicine market is very appealing and potentially profitable, as we've just discussed. But generally, we have a lot of physicians that are coming from all walks of life. Some of them are coming from emergency medicine background, obstetrics, GP, and they are coming from specialties or from environments that are very busy, very stressful, and they are also getting into aesthetic medicine market to have a more balanced lifestyle and a more rewarding day-to-day job. So let us look now at the training, and I will that will conclude my part. I will then hand you over to my colleague, Mr. Milton D'Souza. He's the course manager at the American Academy of Anti-Aging Medicine. He's a specialist for all the courses that we conduct here, and he will be able to talk you through the variety of trainings that are available, of course, within our organization, but also on the market, to include also free trainings.
Hi, everyone. Thanks once again for joining us today for this webinar. My name is Milton, and I'm the course manager here at A4M Dubai. So I just wanted to cover, a few points on getting trained, starting. how to get into the field. So there's obviously a couple of ways you can get started. Some of them are free training resources. We'll discuss conferences versus courses, how you could select a course, what you should look for, what you should ask, and then we've got A4M courses, of course, our own courses, and an important one, which is overcoming key challenges. So in terms of training resources, we've got very popular is YouTube. YouTube has many tutorials, ranging from a few minutes to a few hours. It's a good way to get acquainted with various procedures such as injectables, lasers, other procedures. And while there are a ton of videos available online, do keep in mind that not many of them are from our region, and therefore some of the information may not be applicable or relevant to the patients in our market. With so much material available online, you may find that the information is also quite fragmented. A structured training, will help you build a strong foundation so that you're comfortable and confident when you start practicing. Next, we have the aesthetic conferences. As a new practitioner, we strongly advise that you should aim to attend at least 1 or 2 conferences a year. Conferences keep physicians updated with the latest trends, new products on the market, new machines, latest protocols. And since the aesthetic market is quickly evolving, it's important to be connected. The conferences can be, of course, maybe even virtual now, or live conferences and symposiums. Well-known physicians, advanced physicians tend to, discuss their patient cases in relation to complications, the newest safety guidelines, and this knowledge can be very, very helpful, both for beginners and for advanced practitioners. We then have the company workshops. Now, many pharmaceutical companies will organize workshops in order to train new practitioners on their products and machines. It is advisable to regularly attend these training workshops because you are learning tips and tricks that are product specific, right? And companies do organize a few workshops a year for the clients. Some of the biggest differences, I would say, between a company workshop and a training course is that a good training course is not biased, right? Training courses will cover various products and protocols that will highlight the pros and cons of all. So we then have selecting a course. Now, there are so many options available out there, and selecting a course can obviously be quite challenging. So when it comes to selecting an aesthetic course, I would advise you to look for the following, right? The first would be duration, right? How long is the course? What's the modality? Is it online, or is it hands-on, or is it both? If it is a hands-on course, is there some pre-course material provided? Faculty, what are the credentials of the faculty? How many years of experience does the faculty have? Are they internationally known? Do they focus on safety? We then have accreditation. Is the course accredited by local authorities? Over here being in the UAE, we're talking about DHA, DHCC, MOH, etc. And how many physicians has the institute graduated, right? Course reviews, a big one. Always ask to speak with other physicians that have completed the course. Ask them about their experience. We've got also group sizes. This is very, very important. You need to, understand what is the group size when it comes to the hands-on training. Will you be injecting on live patients? What specific indications are going to be covered during that hands-on training? Will you be confident enough to offer these aesthetic procedures to your patients once you complete the training, right? Then we have location. Another big one, which is important, is it a clinical environment where you're going to be trained? Do they have an educational permit and a clinical permit to offer these courses? We then have the course support. This is a big one for the beginners looking to get started. Will there be support provided once the course is completed? As a client entering the new field, you need the support of your colleagues and your trainers. And then we've got international versus local certificates. What is the accreditation? Is the course, recognized internationally? Are you planning to use this certification abroad in the future? This is important, when deciding which course you'd like to register for. And of course, the costs, how is the course priced versus what is being offered, right? What are the payment terms? Is there a flexible payment plan that is available for that particular course? Okay. And let's move on to the clinical guidelines to look out for. So some of you may have completed hands-on training with other providers in the past. I just wanted to touch upon some of the areas that we focus on during our training, right? So at A4M, sorry about that. At A4M, we always aim to have a natural look, and we want to focus on patient safety. Our training is all about minimizing risks while ensuring the best clinical outcomes. We want to make sure that we train you on all the necessary steps to get you started. For example, when it comes to neuromodulators or Botox, you will first learn how to assess the patient, right? How to decide what indication he or she needs. You will learn how to dilute the product, how to inject intradermally, how to control the elevation of the eyebrow. For fillers, we will teach you how to use a cannula, while both cannulas and needles will be discussed. Safe injection techniques and the basics will be discussed in detail. How do you avoid bruising? How to do subdermal injections? How to do nasolabial folds and deep injections? You will also learn how to build an OG curve, how to inject retrograde. For the lips, we will discuss how to avoid an unnatural look. Lips can be done with a needle or a cannula, and we recommend never injecting the border. Fillers migrate up and down, which is why you shouldn't. We will show you how to evaluate the patient and how to check for symmetry, how to correct the thinner side, checking for upper to lower ratio. Our faculty will provide the international protocols and standards, and the course curriculum is always updated to reflect the standards and guidelines. And this is important because we continuously update our course curriculum to ensure that we are teaching you what is relevant today. So the next slide, I'll just briefly explain fellowships and certifications. I know my colleague Sarvan covered it in brief, but you could start off with a 2-day course, which is just a hands-on intensive course where you could come in for 2 days and you could learn injectables, Botox or fillers, or it could be lasers or body contouring. This is one way to start, which is just a hands-on course. We then have the certification, which is specifically for physicians who want to specialize in injectables. And that has 1 online module and 2 hands-on, where you would cover the basic and intermediate indications of Botox, fillers, and threads with an assessment. And our flagship program is the fellowship, which covers, I would say, everything that you could do within a clinical setting. And that is injectables, lasers, body contouring. So this is the whole spectrum of aesthetic procedures that can be done in a clinic, right? And each, of course, has its own investment. and of course, has its its different advantages, right? So we also have course materials, and these are printed materials that we give you. So besides the online module, which covers excellent theory, we also have a PDF booklet that is given for each hands-on module. And these are quite detailed. They contain injection markings, product dilution information. Obviously, you might, need to review some of these, procedures and details. So this is why this booklet is handed, and it also will have anatomy that's covered. It will also, have other information as well. Okay, and we also provide you with a course material. This is a video library, and before you come in for any of our hands-on courses, we ensure that you have these pre-course materials that you can watch and get well acquainted with before you come for the course. So this would give you a good idea of what exactly you would be learning, while you are with us, for the 2 days. The support group, these WhatsApp groups that we have are very, very, very active, and it's always busy. We encourage all physicians to share ideas, ask questions, support each other. The trainers, of course, are contributing as well to this group. So we have a dedicated group also called A4M ASAP, and this is dedicated specifically for complications. As any physician in need of urgent assistance will use this group to get a quick response from our senior faculty members. And these groups will give you a sense of support. We want to make sure that you have continuous care once you complete our course as well, which is why we have the great community that we have created in terms of A4M aesthetics. So we've got a lot of physicians that are supporting each other. We've got advanced physicians that are advising maybe the ones who are just starting into the field, and it's nice to have these mentors by your side, especially when you're in a new field. So I just want to cover some of the challenges. This is probably on everyone's mind. So of course, there's a few key challenges I would say that every practitioner faces before entering the aesthetic market. So there's a few of them here that I'll cover. The first one would be the budget. Budget constraints are faced by most practitioners. Many are not aware of the key differences in the training setup of different institutes, which is why I had covered in my previous slide where I said you have to look into what is exactly is being offered before you commit to a training. Our courses are priced above the market average because we accept very few physicians in our hands-on courses. And when deciding on a training, there's these different factors that come into play. Of course, like I mentioned, so the most important, will you be practicing on live patients and how many? Because that is ultimately going to make you confident to inject, right? Will you learn how to assess a patient? Will you learn how to properly advise them on what indications they need? So when deciding how much to spend for your course, please keep these factors in mind. Your hands-on skills will ultimately set you apart. The second challenge is obtaining leave. We know this is a big one for physicians, but we've set up our injectables courses on weekends. So it's always on a Thursday and Friday. This is when our basic and intermediate course is set up. The big question, how do you transition into aesthetic medicine? A huge challenge, of course, and is probably why many physicians are reluctant to get into the field because they're not sure how they could do it. I have an example of a client, that had been working in the emergency department of a big hospital here in Dubai for the last 6 years, and he was really interested in making the switch. So he, had completed the fellowship in aesthetic medicine. He considered to start his own setup, his own clinic in the beginning, but what really worked for him was finding a part-time role where he works between 2 to 3 days with the clinic, offering his injectable procedures. And he started last year and has steadily built a great client base. He will do this until he continues to feel comfortable to make a complete switch and work as a full-time aesthetic doctor. And this is what I recommend to many beginners in the field of aesthetics. Take your time, build a steady foundation, and then consider your own practice of working as an aesthetic doctor full-time. The last challenge is, how do you find patients as a new doctor in the field? The aesthetics market is competitive, and investing in good social media marketing is the key to becoming successful. You will need to choose where you'd like to position yourself in the market. You'd have to showcase your before and after pictures, etc. Patient referral is probably the biggest source of patients in aesthetics. And when it comes to procuring products, yes, we will assist you with the various contacts that are needed, and our hands-on booklets contain all this vital information. We've also prepared some starter kits that will give you key details and contacts. So what will set you apart? As a beginner, you need to know what areas to avoid and what not to do. We do cover this in great detail in our courses. If you know what you shouldn't do, you will most likely have natural results for your patients. Safety is a big one, of course. Injecting safely will help you avoid complications and will win your patients' trust. Your patients, they are ultimately your brand. They are your marketing. Dr. Maria Qatar, the clinical director of A4M US and our head trainer here, focuses on internationally valid protocols. She ensures that all practitioners are injecting safely and aims to always have natural looks for patients. We keep our group sizes small to ensure that every physician gets personalized attention while being trained. One of the best features of our courses is the post-course support that I covered in our last slides. That you would always have that WhatsApp group to get back to, in case you need support, in case you need advice, and of course, what we don't wish for, but in case you have a complication and you need assistance, we are there to support you as well. And our groups are also used to have job postings. So sometimes there's physicians are looking for work, and we've got medical directors looking for physicians, and that's also posted on our groups. And then lastly, we have the certifications. AFRAM certifications are conferred by the American Academy of Anti-Aging Medicine in the US. Our credentials are also fully accredited by the Dubai Health Authority and the Dubai Healthcare City Authority, which will help you meet your local health regulations. Right now, we'll be taking any questions. And I would like to thank you for joining us today for this webinar. In case you have any questions on the courses, on how to get started, if you would like some information on regulations because you don't know who could do what procedures where, in which zone, you can get in touch with me directly. My number is on the screen. I'm reachable by phone or by WhatsApp or by email as well. Thanks again for joining us for this webinar, and we look forward to supporting you in your educational journey.